My name is Ankit Desai. I'm here today with Florida Plastic Surgery Group to talk to you about tummy tuck, also known as abdominoplasty. Many women come and see us either after having children or undergone a weight loss journey, whether through surgery or through just diet and exercise, to help contour and rejuvenate their abdominal wall. What that means is they may have some excess fat that they want to get rid of, or some excess skin in their abdomen to try to get a flatter, leaner looking abdomen or belly. When we see these women, we talk to them about their options. And there's a whole host of varying options for patients wishing to undergo abdominal wall rejuvenation or a tummy tuck. And it begins from a spectrum. So it begins with something we call a mini tummy tuck. Moving on to an abdominoplasty or tummy tuck, we can even add liposuction. And the most common way we refer to that is a lipo-abdominoplasty. A mini tummy tuck generally involves just removal a little bit of excess skin, which is all below the belly button, and trying to keep that scar really low in the bikini line. And just to try to give you an example, this is a typical scar for an abdominoplasty or a regular tummy tuck. And a mini tummy tuck is just an abbreviated version of that. So it's just a much smaller scar. But for patients that have a significant amount of skin, or when they sit down, they feel like there's a large amount of skin that hangs over, those patients generally benefit the most from abdominoplasty. That's where we remove the skin and fat from the belly button down to the mons pubic region. And we take that skin and fat and use it to remove it and tighten the abdominal wall. So at the same time, many women that have excess skin or have had children have a separation in their muscle. And it's not, some people think it's a hernia, but it's really not a hernia. It's called a rectus diastasis. And this is a good example. So this shows the muscles that are separated. Generally, our rectus muscle, when you got a 3-pack on either side, so that makes a 6-pack, they're separated, and from pregnancy, weight gain, or even weight loss, and even just age. And we want to bring those muscles back together because that gives us kind of that contoured look and kind of gives us a leaner abdomen. And so what we do is we suture those muscles in an abdominoplasty back together. And that just gives you a diagram to represent that. And so as we suture those back together, we do it with 2 layers to try to provide redundancy and support. And then we tighten the skin as we've just removed the lower abdominal skin. The top comes down to the bottom, and we get a much flatter, leaner abdomen. In some patients, they not only would benefit from removal of the excess skin, but also liposuction. And that's where we talk about lipo-abdominoplasty. So if it's not just excess skin, but there's also some fat in unwanted areas, we add liposuction to the area that we kind of leave behind. So if we're removing the tissue from the belly button down, that leaves kind of a rainbow of tissue above. So there's the hips, what we call the flanks, and the upper abdomen. And we try to liposuction that to really help contour the entire abdominal wall. So that way we're flat, lean, have a abdomen even at the lower incision level that doesn't hang over, and we can give you the best possible result. Patients that have abdominoplasty, we talk about recovery and the time. Generally, no heavy lifting or exercise for a month. But we generally try to avoid core activity to protect that muscle tightening for 6 weeks. And so for those you considering abdominoplasty, try to become weight stable. That's number one. We want patients to not be smoking and, generally just be in their overall good health. And those are really great candidates for patients that have excess skin and or fat that they just can't get rid of with diet and exercise. We're here to help. Keep tuned in. We'll be happy to help. And if you have questions, call our office. We'll see you soon.